Dennis Lox, who's sitting with us. Good afternoon, sir.
Good afternoon.
Welcome, Dr. Lox. What is your connection with Dr. James Andrews?
Well, I've been speaking both nationally and internationally, and I do some presentations, and so we started chatting about something I'm putting on about athletes and stem cells in Rome this summer, and he and I were talking about the best way to go about it, and his associates and where they're at in the stem cell arena, and they're just beginning. And so it's interesting to see the evolution of somebody who's cutting edge versus the average orthopedic guys still don't even know you can do it.
And here in the States, from what I understand, it wasn't legal for stem cell for a while, and that's why athletes went to Europe. I know big-name athletes had gone to Europe for this procedure. What is the status here now, Dr. Lox?
Well, that's a misconception.
Okay.
It's never been legal. The status is it's still deemed experimental, and it's experimental because everything wants to be FDA approved as a drug, regulated, and that's part of the political system. But earlier it was more of a religious and a political connotation. The religious connotations are gone because it's adult stem cells. It's not embryonic.
Okay.
So it's basically a misconception.
Now, but people were going to Europe and going to Canada back in the day. Was it because there was a lack of, doctors in the United States doing this? Or?
Well, it was more, there was a shroud of this mystery, and athletes didn't want to admit it because of that religious political overtones. They're now starting to change. Peyton Manning was just, I'm doing it. Rafael Nadal was very hesitant. He would admit to PRP but wouldn't come out to the stem cells. Just recently, he's admitted to back stem cells and knee stem cells.
All right, let's talk about that. PRP. I had PRP done on my knee probably a year and a half ago.
You loved it, didn't you?
Unbelievable results. I was going to have meniscus repair. I've already torn the ACL in that knee, had a ACL reconstruction from a cadaver, and then I hurt the same knee and it was torn meniscus. I was going to have surgery, had an MRI. Then I had the PRP, and fantastic results. How was that different from the procedure you did with Ian?
Well, PRP is really great for some conditions. If you're in a tennis tournament and you want to get better in 2 weeks, that's a good option to help decrease inflammation. But to repair and regenerate tissue, the PRP lacks stem cells, so it's not going to do it. So if you're dealing with a surgical condition where they took tissue out, or if you're older and you're developing osteoarthritis, such as Ian with prior surgery and the beating he took in being a professional football player, you really need to repair it. And so it's just it's a spectrum of what you can do and what your goals are.
And the stem cell comes from his own body. That's why you drug it out of his back?
Well, he explained it to me.
I drugged it and hit him over the head with a club.
Well, he's very technical, this guy. Now, I think you explained it to me where stem cells repair. Okay, they repair your body. When you remove it and you put it in your knee, it goes to anything that's ailing. Is that the way it goes? Pretty much. I'm not a doctor.
No, that's excellent. The stem cells are smart and they home to injured, damaged tissue. So in this case, the damaged cartilage, the injured meniscus, and the arthritic change send signals out that tear the joint down. Those same signals cause the stem cells to home or to be attracted to that site to start their repair process.
Dr. Lox, is that why I should have said drugged? Dug it out of his...
I had a shovel, and that works too.
Why did you take it out of there? When I had the PRP, it was blood taken out of my arm. What is it you do when what part of the body do you remove where the stem cells are?
There are two good sources of stem cells in adult tissue, one being the bone marrow and the other being the adipose or fat tissue. As we age, stem cells drop precipitously, and the fat just has a vastly greater number, so it becomes a numbers game in different patients which selection to do. But bone marrow and fat are the prime sources. So I opted for several different reasons, which we won't go into, why one would be superior.
Yeah,
But
I got great stem cells, I was told.
I found a few.
Yeah, fabulous fatty cells, believe that. Now, I got my knee done, and to break it down, I didn't have anything torn. My knee was just hurting, and I'd be limping. At nighttime, it would swell up, and my knee was killing me. And I got the procedure done about a month ago, and literally 2 weeks later, the pain is gone. And Doc says it's not even really kicked in yet. It's going to kick in a couple months or a month, so I can't wait for that. But the knee is a good place now. Eric, the sales guy, just told me a foot. Is a foot a good region? Because a lot of people have bad feet. I have a terrible foot. Now, that could be my next stop.
That's a really good question. I have gotten patients from all over the world, and one of the things that I've done is I've done a lot of ankles and stuff, and that basically they don't know how to replace ankles very well.
Sure.
The knee is the most common joint, but ankles, they kind of just fuse. So for younger athletes, that ruins your career.
What about shoulders?
Shoulders respond quite well. They're a little more complicated than a knee or hip,
sure.
but I do quite a few shoulders.
And in Peyton Manning's case, it was his neck, I would assume.
That's correct, but he had neck surgery, so that's more complicated that he already had the surgery, so you're trying to repair post-op.
Now, Doc, you pulled it out of my fatty tissue, and you had some left in the vial, and we just did my knee. Now, if I go for another procedure, can you do more than one area? Is that a possibility?
That is correct, and I do that frequently. The knee is the most common joint, and a lot of people have two knees, and one knee may be worse than the other, and I very frequently do both.
Okay, well, I tell you, since I did my knee, and it feels like $1 million, I want to do my other knee, my back, my neck,
your foot,
my ankle, and my foot, and I may have others.
Your neck?
No doubt. No, seriously.
Yeah, sure, why not?
The whole 9 yards. So, doctor, you did great things for me. My knee is wonderful. Now, if anybody else wants some information and how to contact you, how to get in contact with you.
Well, you can contact my office in Florida, 462-5582, or my website is drlox.com. And we're...
LOX?
That's correct, LOX.
drlox.com. Nice to see you, actually, and nice to meet you. You were telling me earlier that we spoke many years ago.
That is correct.
Good to talk to you again, Dr. Lox.
Pleasure. Thank you, Doc.
All right.
Good stuff.